Hello, I'm Natalie and I'm going to be your CNA today and I'm going to help you eat. But first I'm going to go wash my hands and get your food, okay?
Okay.
So here I wash my hands, get the patient's food, also a chair. Okay, so I'm back with your food. Can you please tell me your name?
Natalie Snyder.
Okay, thank you so much. Now that I identified the patient, I'm going to help her sit upright and also close the privacy curtains. Okay, so if you can please just sit upright for me. I'm gonna put her in a high Fowler's 90-degree position. Okay, so now and then I'm gonna put this on the table above her bed. And then, okay, so I'm also going to wipe her hands first. Clean her hands. Okay. Now I'm going to throw that in the trash can. And then I'm also going to tell her her food in a clock order. So here we have applesauce at 12 o'clock, oatmeal at 3 o'clock, and blueberries at 9 o'clock. Okay? So what would you like to eat first?
Some oatmeal.
Okay. So then I'm gonna give her some oatmeal. Here's your oatmeal. And then I'm gonna also give her an option to drink some orange juice. Okay. Now I'm gonna ask her, what else would you like?
Maybe some blueberries.
Okay. Here's some blueberries. Okay, now that I gave her her blueberries, I'm gonna also, would you like to drink some orange juice as well? Okay. So now that the patient has finished eating, I'm going to wipe her mouth and her hands again, wash her hands again. Okay, so then I will put this in the designated dirty area. Okay, now I'm going to lay you back down in the lowest position. You can go ahead and lay down. Okay, make sure she's covered. Put the bed at its lowest position as well, and make sure that the bed wheels are locked, and give her the call light. And then I'm going to go wash my hands. Okay, is there anything else you need?
No, I'm okay, thank you.
Okay, and hello, Ms. Snyder. My name is Natalie. I'm going to be your CNA today. First, I'm going to help you put on elastic stocking today for good circulation in your body. But first, let me go wash my hands and gather my supplies, okay? So this is where I wash my hands and I gather my supplies. Okay, I am back. This is where I'm going to close the privacy curtain and check that. Can I please check your wristband, please? Okay, thank you so much. I'm going to make sure that the bed wheels are locked and it's in a good working height for me. Okay, so I'm just going to uncover your right leg and put the elastic stocking over your right leg. So first I'm going to get to the heel and then turn it out. Okay, so now I'm going to put it on, make sure that the heel is matching with the other heel, and it's going to go all the way up. And then I'm going to further inspect it and make sure that there's no wrinkles or anything around her leg. Okay, it seems to be perfect. And then I'm going to cover the patient back up. Okay, we are all done now. And is there anything else that you need?
Oh, no, I'm okay, thank you.
Okay, so this is where I put the call light in the patient's hand. Okay, here's the call light. And check that the bed wheels are locked as well. Lower the bed to its lowest position. And then go and wash my hands. Hello, Ms. Snyder. I'm Natalie. I'm going to be your CNA today. I'm going to be helping you with passive range of motion, which is just moving your leg and your ankle and getting that that motion in, okay? So, but before I begin, I'm gonna go wash my hands, okay?
Okay.
So then here I go wash my hands. And then I'm coming back. I'm gonna close the privacy curtain. And then I'm also going to check. May I please check your wristband? Okay, thank you so much. I checked the patient's wristband. I'm gonna check that the bed wheels are locked and make sure that raise the bed to a good working height for me. Okay, so now that I raised the bed for a good working height with me, I'm going to start on your right leg, please. Thank you. I'm gonna uncover this, okay? Now I'm going to bend. I'm gonna support your knee and your bottom ankle, and we're just gonna go towards your head, and then we're also gonna go towards the bed, okay? So now that I'm supporting her knee and her ankle, I'm going to just, please let me know also that if you feel any physical pain as well, okay? So I let the patient know if she feels any physical pain to tell me. So now I'm just gonna bend towards your head. 1, 2, 3, 4. Now towards the bed. 1, 2, 3, 4. Do you feel any pain?
No, I'm okay.
Okay, we're gonna go 2 more times. 1, 2, 3, 4. And then back. 1, 2, 3, 4. Okay, did you feel any pain after that? Okay, we're gonna go 1 more time. 1, 2, 3, 4. And then 1, 2, 3, 4. Okay, did you feel any pain at all?
No, I'm okay.
Okay, so now that the patient doesn't feel any pain, I'm going to also work on her ankle. Okay, so we're just gonna bend your ankle towards your head and then also back towards the bed. Okay, so 1, 2, 3, 4, and then 1, 2, 3, 4. Did you feel any pain at all?
No.
Okay, and then we're gonna bend 1 more time, or 2 more times. 1, 2, 3, 4. 1, 2, 3, 4. Okay, so now that we bent twice, did you feel any pain?
No.
Okay, we're gonna go 1 more time. 1, 2, 3, 4, and then 1, 2, 3, 4. Okay, did you feel any pain at all?
No, I'm good.
Okay, so now that I did a passive range of motion, I'm going to cover the patient up, lower the bed at its lowest height, and make sure that the bed wheels are locked. Okay, and here is the call light if you need anything. Did you need anything else?
No, I'm okay, thank you.
Okay, so now that I asked that the patient if she needed anything else, I'm gonna open the privacy curtain and then go wash my hands. Okay, now I'm going to be measuring and recording urinary output. Okay, but I've just washed my hands and now I'm going to put on some gloves. Okay, now that I have some gloves on, I'm going to take my bedpan and I'm going to put it in my measuring device. And then I'm gonna put it on a flat level surface and I'm going to rinse out my bedpan in the toilet and put it in a designated dirty area. Now I'm going to go at eye level and record my urine, and it's about 400 milliliters. Now that I measured my urine, I'm going to I'm going to put it in the toilet and rinse it out and put it in the designated dirty area. And after I've done that, I'm going to take my gloves, take them off securely, put them in the waste. Then I'm going to wash my hands, and then I'm also going to record what I measured. So it would be 400 milliliters. Okay?